Good morning, the Ridge Medical Practice. Vicky speaking.
I'm going to be honest with you. I am smoking weed. I know it's not the right thing to do.
When I was a kid, it was really bad because she got it.
Yeah.
It makes me feel ashamed, you know.
Don't feel ashamed.
It wasn't empty that time, was it?
No, you're an awful girl.
Which bit do you think you find the hardest?
Everything. You just want everything to go away.
At my age, you know, you can't leave things too long in case you pop off in the meantime.
Hi, Emily.
Hi.
Right now. Come and take a seat, please. How can I help?
I've come because I've tried to get rid of thrush on my tongue.
On your tongue?
Yeah, I've bought stuff over the counter and I've tried multiple different things and nothing's working. And I even went to a clinic because I thought it was like an STD, but they said it's not.
So it's good that you've been to a clinic?
Yeah.
That's good.
But it was embarrassing that it actually wasn't.
How long have you had the thrush on the mouth?
Months, like 6 months.
6 months?
Something like that. I've been trying all sorts of different stuff.
6 months is a long time.
What causes it?
There could be a lot of different things, actually, why you get it.
I've read that mouthwash were bad, which I was quite
Yeah.
surprised by.
Sorry?
Mouthwash, I'm
Yeah.
using too much, and I do use a lot of mouthwash, so
All right. It can be also related to other things, like if your immune system's down, or like things like diabetes as well.
no, both of them aren't in the question, I don't think. So if it's not an STD, you can't catch it off people?
Here we are.
Thank you.
Now then. So if you come in and have a seat. And this is Rabia.
Hi, Rabia.
Who's our student today. So hello again, Mrs. McIlvenny.
Hi, Doctor.
And you've come back to tell me what's happened with your ear.
It's not as bad as it was, but there is still tenderness there and there was some dry
Right.
skin.
Okay.
And the other thing was the one on the chest. I knocked it off cleaning myself and it bled. You know, you said to
Did
keep
it?
your eye, and there was
Yes.
blood.
Any other bits concerned you at all?
Well, no, you did. I mean, I do have some more that I'm not happy about, but I think it would need a complete overhaul to look at all my skin. There's lots, but probably not
we'll
today.
start it with the ones that are troublesome, shall we? And it's your right ear.
It is.
Find the troublesome bit for me. Yep. And it's almost gone. It is
Yeah.
tiny. It's a lot better than it was. Do you mind if Rabia has a little look?
No,
So
carry
there's
on.
just this, see the little tiny area of thickening there? You can just about feel it. But when we started, it was much
It
larger and
was,
thicker and
yeah.
scalier.
And there was need to have half my ear off.
You've still got your whole ear, so you have. Can I have a little look at the other bit?
I'll just need to
Find
feel
it for me.
you. Yeah.
Just at this bit here.
Yeah.
That's absolutely fine, though. Okay. There's no sign of any worrying features there. No
Okay,
sign of
that's-
any early skin cancer. You've still got a little bit there, so I do think another squirt with the liquid nitrogen might
Well,
be of help.
The last time, your bottle must have been empty, James Bond.
Surely not. I've just been to fill it just now, so
Right,
there's definitely some in today. So this is called cryotherapy. We decant a little bit of liquid nitrogen into this. It's very cold.
This is why I call her James Bond when she's on this in her hand.
Oh, you make me feel swell-headed, you will, really. Look, there's definitely
it's
some in.
ready, isn't it?
Yes? 3, 2, 1. It wasn't empty that time, was
No, you're an awful girl.
it? Terrible. I do apologise, but you know what we're trying to do, even though it's taking a while, is to avoid us having to cut any bits out of your ear.
Yeah.
You don't want a nick out
I don't
of your
want to
ear.
be a Van Gogh, do I?
No. There's very little left of it, though, so I'm hoping very much that that'll be the last time.
Yeah, you said that 3 times ago.
Well, I'm an optimist, that's what it is.
got better, hasn't it?
But that was a proper squirt this time,
Certainly
wasn't
was.
it?
You're getting your own back on me.
So I'd like you just to leave it alone,
Yeah.
but I'll still need to check again. About
Yeah.
6 weeks.
Yeah, that's great.
Thank you very much for your
Thank you,
patience.
Doctor.
Thank
Yeah.
you.
Thanks.
Bye now.
Bye.
Thank you.
Bye-bye.
It's not a thing that you normally would catch, thrush in the mouth. Have you been in contact with anybody with...
Not. I think you'd notice if they had a white tongue.
So have you had a full checkup as well?
Yeah, everything's fine.
Including like HIV
Yeah,
and
everything.
everything's clear?
Yeah. I go regularly, so I'll be getting a text again soon.
Oh, that's good then. Let's have a look. And
It is quite sore as well.
Does it feel sore?
Yeah, it depends what I'm eating, but
Okay.
it's obviously damaging the surface of my tongue, whatever it is.
And is it painful when you
No,
swallow
not
it at
really,
all?
no. There's
You
no
don't feel
pain.
like
It's
food
spicy food makes it worse.
So we'll give you a tablet, okay?
Right.
To take. And you need to take it for a couple of weeks. You're not allergic to anything, are you?
No. Should it start to show signs of clearing up? How quickly?
You should be able to see some difference within 72 hours.
Right.
And also, if you can just arrange to have a blood test done.
Yeah.
We'll just check you for anemia and just check for diabetes as well, okay? And hopefully by that time, things should have cleared up.
Yeah.
If it hasn't, we can give this treatment for a bit longer as well,
Right.
okay?
What are the side effects on it? Am I going to get any?
Well, there's always side effects to medication,
Are the
but
chances of them bad?
no, but which side effects are you worried about?
Like nausea and stuff.
Yeah, you can get...
Fatigue, because there's really common.
So you can get nausea with most medications, okay? Try the medication first, okay? If you get side effects that you really can't cope with, come back and then we'll have a chat again.
Right.
All right? Book for a blood test at the front desk and we'll see you in 2 weeks' time.
All right, that's
Okay?
great. Thanks.
Thanks. See you later.
See ya. Is it this way, yeah?
Yeah, that way, yeah.
So, what if I got you an appointment today? Would that be okay?
Unless it's this afternoon, I can't come this morning.
See what I can do, Dorothy, okay?
Thank you, love. I'm out of breath.
Do you want some water?
No, I don't drink water. That's for wimps. I drink wine.
Morning, Leah. Who have you brought with you today? And how can I help?
She got sent home from school on Tuesday with headache, feeling sick, not well. I was going to send her today. She's still crying with headache and belly pains. I thought, well, let's bring her to the doctors.
And are we eating and drinking, or...?
Not really, not for her. She can eat a lot.
Can she?
Yeah.
All right, so this all started Tuesday, a couple of days ago.
She's told me she's not really weeing much either.
Right, OK. Is that because you're not particularly drinking much, do you think, or...?
You look exhausted. How can I help?
I've got a bad cough.
Okay.
And it's keeping me awake at night. And I'm not too bad with this through the day, but when I lay down,
Okay.
and I'm just worn out because I'm not sleeping.
No, of course, yeah.
You know, so I thought I'd better just check it out. 'Cause
Yes.
At my age, you know, you can't leave things too long in case you pop off in the
Don't say that. Okay, let me have a little look at you.
Do you want me to take my coat off?
Please.
Which arm do you want?
Your left one, if that's okay.
I wanted to ask you as well, with going to the toilet so much, you know I've got a stent in, don't you?
Okay, yeah.
I don't want to stop going, obviously, because, you know, I don't want a blockage or anything.
Yeah.
Over a course of a night and a day, I go about 8 times.
Okay, I understand.
And it's weakening me.
Okay, we'll have a look at that. All right.
All right, love.
That's on the low end of normal. I'll see how that is for you. It's not too low.
Well, I mean, I am 92 after all, so what can you expect?
And you're still with us, so that's nice, isn't it?
Yeah.
Right then, can you take a deep breath for me? Okay, good. Right then, let's have a listen. Okay. There's a little patch of crackly noises in your chest, so I think you need a course of antibiotics to make that better.
What does the crackling mean?
That you've got a chest infection.
Oh.
Little popping noises.
But will I live a bit longer?
I hope so. How How long would you like to live?
Not much longer.
Oh dear, really? Do you think you might get to 100 and get your letter from the Queen? What do you think?
No, thanks. I don't want to live to be 100.
Well, that's only 8 years away. Isn't it? That's not too long. This problem that you've mentioned to me about your bowels, that's not just with this coughing, that's been going on longer.
Oh, yes, it's been going on quite a while.
Right,
yeah.
all right.
Yeah. Taking a bit of something to cool me off a bit, you know, with my bowels.
Yes, I'm giving that some thought.
But for goodness sake, don't stop me going with you, because I've a horror of not being able to go.
I'm going to just ask a colleague or look in the medicines book. I just want to check that if we give you something like Imodium, it wouldn't bung you up. I will come back to you in just a second. Okay.
Yeah, okay.
So it sounds like you might have a bit of a bug going on, doesn't it, if you've got the diarrhoea. So you haven't been sick, but you feel sick? Yeah. So do you like school? No. OK, so that's not showing any infection or anything, it just shows us what we know, that you haven't had enough to drink, really. I need to have a listen to your heart and things in your chest, all right? So we'll need to take your top half off. Do you want to come behind the curtain while we do that? Yeah? Come on, then. Are you coming round, Mum?
No, she'll be all right.
Do you want your Mum? No?
At first I thought my tummy hurt from my periods at first.
You what, lovey?
I thought my tummy hurt from my period, but then...
But then it felt a bit different. So it's a bit all over is the pain, is it? Yeah. Does it feel a bit better when you've had a poo? Yeah. All right, I'm just going to have a little feel, OK? There's no worse area that feels worse than any others?
No.
No, it's just all over?
Yeah.
Yeah? All right, lovely, let's get you up. I think with the symptoms that she's having, it's a bit of a bug, a bit of a virus that she's got at the moment that's giving her this diarrhoea and everything, OK? From a school point of view, they don't want children that coming in when they've got diarrhoea, and you need to give it at least 48 hours.
Right,
so
well,
really
break
when
up tomorrow, so...
Oh, do they? Right,
Yeah.
OK. But what we do need to do is have lots of fluids, probably still drinks rather than fizzy drinks as well,
Yeah.
OK? Do you think you could try something to eat?
I'll try.
Yeah. Just go for something really plain, like a cracker or a digestive biscuit or a piece of toast, you know, something like that. If any of that tails off, so you're not being able to eat or drink, or you're not drinking, and you know things about if you develop a rash anywhere, anything like that, you're concerned, she must be seen again.
Yeah.
All right.
All right, cheers.
You take care now. See you
Cheers.
later.
See you
Bye-bye.
Her hair's gorgeous, isn't it?
Look at this.
You like it. You want
like
to
a
play
pony.
with it.
It's
don't
like
you?
a pony. And does it what look like with blonde hair? I might dye it.
Go to the mirror. No, put a fringe on.
Hello. My name's Karen.
What? Are you trying to say I look like that?
No.
OK, I've checked with Dr Eunice, and she thinks that loperamide, which is Imodium, will be good. So we'll start with a low dose.
Low dose.
OK, just get to the right level so that it's making the symptoms more manageable for you.
Yeah, OK. Now, one little thing I wanted to ask you, they've sent me about the flu jab.
Yeah.
Have I to have it?
I'm quite happy to give it to you today, if you like.
Today?
Yep, you don't have a high temperature, so you're fine to have the flu
But
vaccine
won't
if you
it
want.
affect me with having a bad chest?
No, if your temperature's normal, then we can give you your flu
I might
vaccine.
as well have it then and get done with.
Yep.
Save me coming down
Coming back.
again, won't it? Yeah, smashing.
You're not allergic to eggs?
No, not that I know
Not
of,
that you
no.
know of, no. Fine. Right then, here we go. This one. Is that all right to put it in this one?
Yeah.
There we are.
I wish all things were as nice as that. 2 minutes, well, half a minute and it's done. Smashing. Right, have you done with me then?
I think I'm done with you now. Yeah.
Right.
So common side effects, I'm sure you're familiar with all of this. Muscle pain, headache, fatigue, slight tenderness on that arm. That's really normal. Only lasts a day or two at the tops usually.
Right, thank you very much for all your help. Very nice of you.
Bye-bye now.
I don't want to be awful, but I hope I don't see you
Yeah,
again.
all right then.
Which way do I go?
That way.
Oh, this way, thank you.
Okay, bye.
Bye.
Come on in then. Do you want to take a seat for me, Charlotte? So, Burning question is, when did you last smoke a cigarette?
Is it 2 weeks or is it over now? But I've just had a really stressful weekend, so I have been smoking.
OK, so we'll do your carbon monoxide reading.
Oh, I'm going to cry in a minute.
That's it, keep blowing.
Oh, I'm waiting for it to go up.
What's it reading?
22. It's come down a tiny bit.
Yeah. Have you been smoke-free for 2 weeks?
2 weeks, yeah.
Well done.
Oh my God.
Right.
I'm proper, like, I can't. I'm so excited to blow into that. Honestly, I am. I'm just like, oh my God. I'm proper nervous, like I'm starting to shake.
What are you expecting it to be on that chart today?
Well, ideally, in the green zone.
Yeah. So, shall we?
If not, I'm going to be disappointed.
OK.
What do you think it might be then?
I think if you've not smoked since your last appointment, it's going to definitely be that of a non-smoker. I mean, there are varying reasons why, but let's do it and find out.
Oh, proper like on the edge.
OK.
Oh, gosh.
I'd like you to take in a really big deep breath. So breathe in, hold that breath, and just a small blow. So that's it. As fine as that, Charlotte.
Oh my God.
Lovely.
7.
OK.
It's on 7. So.
OK. I know you're going to ask me, why is it not a 0 or a 1?
No, I'm happy with that.
Good.
I'm happy it's not in the, like, 20s.
I mean, it's nothing I'm concerned about, and I don't think it's anything for you to be concerned about. I'd just like to really congratulate you for it.
Oh, God, I'm so happy.
Well
I'm going to
done.
celebrate. I mean, I don't know what I'm going to do later, but I'm going to celebrate.
Have a lozenge.
I know. I've got them in my bag now. I want to get to 0, though. Is even a 0? What I'll have to do is I'll have to
I've never seen anybody blow a 0 on that machine.
Really?
Yeah.
That's my goal then, to blow a 0.
OK.
I'll have to come with a
You'll
mask
do
on
it
next
as well,
time.
won't you? I know you will.
I will.
So I'll see you in 2 weeks, won't I? Oh,
my legs are killing. Come here. Oh, I'm so happy. Honestly, God, I'm really
pleased for you.
Hi, Mr. Woolley. Come
Hi.
in. Where's Mrs. Woolley?
She's...
Oh, she's over there.
Yeah, she's over there.
Hi, Mrs. Woolley.
Hi, love.
You all right?
She's saying, how do we cope? I said, you have to cope
Yeah.
today.
Come in.
Thanks, Dr. Khan.
No worries. Nice to see you both.
Yeah.
I like your top.
Thank you.
Right, so I've got the letter from the hospital. I think they've spoken to you about things as well.
We went to see them, yeah.
Yeah, so tell me what your understanding of everything is.
It told me it was something like a rogue growth. It's a form of skin cancer, but I don't know how far it's gone into my eye.
What they've said is that you've got something called a basal cell carcinoma, which in the initial stages can be dealt with quite easily with just taking it off. It is a type of skin cancer, but it's not a malignant type of skin cancer.
That's what they told me, yeah.
And the reason it's not malignant is that it doesn't shoot off to different parts of the
Yeah,
body.
that's what they said.
Yeah. So they are going to take off quite a large part because we have to get a good margin of normal skin as well around it. And it's reconstructive surgery that they're going to do, which is likely to involve a skin graft.
Okay, no
Do you know
problem.
what that means?
Take a piece of skin from somewhere, don't the doctor?
Usually the most common areas are around your buttock area. And because it's quite a large area here, they will graft that skin onto your skin around your face and try and get it to look. And they're fantastic. The plastic surgeons are absolutely brilliant. You know, try and get rid of that. How are you feeling about it all?
It's depressing.
Yeah,
it's
I bet it
depressing,
is.
Because
it's important that I understand how you're feeling about everything that's going on.
I think he has been feeling a bit down. I think he has. Yeah, a lot. I know he
How
has.
down?
Down.
I know he has.
So down. I know you've got a lot of family support, but do you ever feel so down that you wish you weren't here?
Dead.
Right. How often does that happen?
Quite often.
Does it?
Yeah.
Now, this sounds like a bit of a funny question, but it's just something we have to ask. Have you ever made any plans to do anything or nothing like that?
Never.
Okay.
No, it's just, it pops into my head. You know, that you just want everything to go away.
Yeah.
Yeah.
You know,
Yeah.
it's so hard.
Yeah. I can imagine. I mean, I just see you briefly every now and again, and I can see that you're struggling in those few minutes that I see you
So
for.
hard.
Yeah. Which bit do you think you find the hardest?
It's just everything. You know, I've been hit with so much.
You really have.
Diabetes, epilepsy, skin cancer.
Yeah.
You know, it's enough to get you down, Dr. Karen.
Yeah. Does it help to talk about it, do you think?
I do talk to Joan.
Yeah.
But she's got problems.
Are you okay? When you're suffering from one chronic illness, it's bad. When you're suffering from a list of chronic illnesses and you're in pain as well, you know, it's hard for people who don't go through it to understand that because it's constant. There's no break from it, and I think that's the.
I just want it to go away.
Yeah. We know you're on antidepressants. No tablet's going to take all this away, as you know. But if sometimes we add in another antidepressant to work in a different way to the fluoxetine, so you're taking it in addition to try and help you...
Click me out of it.
Well, yeah, it won't do anything by magic, but it might just lift you to that point where you're not feeling like you wish you weren't here every day, you know, and I think that's where we need to aim for.
Yeah.
I'm going to book you an appointment with our counsellor based here.
Yeah, brilliant, yeah.
And they're longer appointments, and she'll book your follow-up and just tell her exactly how you're feeling, you know, don't hold back, because you might be surprised yourself about how you're feeling and how low you might be feeling, and she can give you some advice. Is that all right?
Yeah.
Thank you, Dr.
My
Khan.
pleasure. Honestly, you can come and talk to me whenever you want. If you haven't got an appointment, just rock up at the desk and I'll squeeze you in.
Well,
Yeah, I will. All right, so don't stress about appointments and all of that.
No, I'm just...
You're all right.
Yeah, I'm there, I'm getting there. Just, you have to do, aren't you, to stay strong.
You know.
And the good news is he's going to be a granddad again.
Ah, very nice.
After 16 years.
Oh, that'll book you
She's coming at Christmas.
Too much
think you got your hands full now.
Yeah.
Too much money, mate.
Thank you very much,
Right,
Dr.
cheers.
Dr. Khan, once again, mate.
My
Thank
pleasure.
you.
Honestly,
Thank you.
anytime, just rock up, I'll see you.
Right.
All right.
Thanks, Dr.
Thank
Khan.
you,
Take
Dr.
care.
Khan.
Bye-bye.
Bye.
Can't stop yawning.
Hi. Oh, there we go. A roommate.
Yes.
Hi.
Hello. Hiya. Come in here, please. Sorry for waiting.
It's all right, we're nearly falling asleep.
Did you?
Nearly. No, I just came straight from work, so...
I've got a medical student
Yeah,
with
no,
me,
it's
if
not
that's
fine,
all
it's
right.
fine, yeah.
What can I do for you?
Basically, I'm in a lot of pain. And to tell you that, I'm going to be honest with you. I am smoking weed because of the pain, and it does dull it a bit. I've been taking, is it gabapentin?
Gabapentin,
Yeah, I had some of them left from before. Now, they do help if I take them constantly,
Yes.
but they don't take it away fully.
No. Pain is so bad that you had to rely on weed, you said.
Yeah, I know
Gosh.
it's not the right thing to do.
Did you see that Lenny Henry thing last night? That's that Lenny Henry thing on BBC One. Look, no Lenny Henry, don't you?
There's a black guy in here and I should know who he is.
No, that's so scared.
I don't even know what Malcolm X did. So about
He
Malcolm X.
had a dream. No, that's Martin Luther King.
Malcolm X do?
He was the Black Power.
Did he do Ready Steady Cook?
No.
Who? Martin Luther King. What were you on about?
When did it first start?
Carpal tunnel.
When did you have carpal tunnel then?
Well, I had the operation about 2-3 years ago.
I see, okay.
And I haven't been pain-free since. This, I mean, you know, and what's with the pins and needles?
We'll come to that. I think let's take one
Okay.
at a time, because otherwise
Sorry,
we're gonna
I'm tired. I just want to go home. I do apologise.
Yeah.
Can I just show
Yeah.
you? It's always there in this area.
While I'm here, I'm just going to examine your neck. It's not too bad, is it?
No, that's not too bad.
Okay. So it's more here.
Yeah.
Okay.
You're right on it, actually.
yeah. I can feel, the muscles are a bit tense.
I work in the kitchen. Now, I stopped that job because of this.
Gosh.
I don't want to smoke weed all the time either.
I
so
see. Can I see your hands, please?
Okay.
What did you feel?
Like shock.
Where? Do you feel it now?
Yeah. Yeah.
Whereabouts?
Yeah. There. Yeah.
Here.
Yeah.
Okay, I see. Okay. Let's examine your toes, should we?
Oh, I will have very smelly feet.
Okay. Close your eyes, please, for me. Do you feel me touching you?
Yeah.
Now?
No.
Now?
No.
Now?
Yes.
Now?
Yes.
Now?
Yes.
Yes. Keep your eyes closed. Do you feel me touching you now?
No.
Now?
Yes.
Now?
Yes.
That's fine. You can open your eyes and...
I thought you were going to massage my feet.
You felt like that?
I would really relax then.
So, my feeling is that you have carpal tunnel syndrome on the left side, but not on the right side.
Yeah.
The reason for pain here and
Yeah.
the reason for pain is probably different. So what I'm going to suggest is from 4 to 5 tablets a day, let's increase that to 6 tablets a day, 3 times a day.
Yeah.
And I think when you're doing that, you wouldn't need to rely on anything else for pain.
That's why I've come to you.
If pain is still an issue, I think I would like to see you.
Yeah.
There is still a potential to add other medications and maybe increase the dose. So we've got a lot of things in our pocket. Options here.
Yeah.
Let's stick with gabapentin for time being and do that. You don't seem to have any loss of sensation in your toes. So I think in the first place, what I would like to do is, I would like to do some blood tests. When the tests are done, I would like to see you maybe a week after that.
Yeah, that's no
then
problem.
Decide what we need to do. Don't worry, we'll sort it.
Yeah. No, well, I kept moaning at my partner and he, he suggested the cigarette, but it's not you can't keep doing it.
No, you're right. You know it.
Yeah. Right, thank you very much.
Most welcome. You look after yourself.
I will do.
Thanks.
Bye.
Bye.
Anita, hi, come on in, my love, have a seat. I'm Dr. McFadden, what can I do for you?
I took myself to the hospital on Friday. Kidney stones.
Oh no, who are you?
But I thought it would have passed, but it hasn't. I'll give you the letter that they've
Good woman, we haven't got that yet.
Well, it's just what medication I'm on, and then it's something about reviewing at the doctor's.
Oh, well done for bringing that in, good on you. Oh, gosh. All right, darling. So you're going to have the further investigations and you've been given some medication.
Please, but is there anything different that I could have, or...?
Oh, this is the best
Do you
by
know
far.
when you just got the niggly pain?
Touch wood, I'm going to say no, and I'm going to touch everything here because I've never had kidney stones and I do not want them because I hear that they are grim.
Yeah.
Can I check your temperature for you today, my love? I mean, what we could do, you know, those naproxen, are you taking one or are you taking 2 at a time?
One.
You can
tell me to take one of each.
You can take 2.
Of these ones?
Of the naproxen, yeah. Okay. You can take a dose of 500 3 times a day. Your temperature's okay, so that's good. It's not going anywhere. So you can double that dose. What I'll do is I'll do you another prescription just so that if you do run out, you have another one, okay? And Anita, look after yourself. This is rubbish.
It's horrendous, man. I won't wish it on my worst enemy.
Yeah, people say it's worse than childbirth.
Yeah,
Yeah,
it is.
yeah.
It is.
I
was at work as well, and I had to...
When was your last day at work?
It was Saturday.
You went on Saturday?
Yeah.
Oh my God, Anita, you're a hero. So basically, if you don't feel well enough for work, you self-certify for a week. So if you're not able to go in next week, give us a wee bell. Look after yourself. And as I say, if you need a sick note towards the end of this week for next week, will you let us know?
Yeah, I will do, love.
All right.
Thank you.
You take care. Hope you feel better soon.
Thank you.
Bye, Anita. Bye.
Hi, Mr. Sheffield. Hi, I'm Dr. Card. Nice to see you. Hiya. Nice to see you. Come and sit down. Right, got you down for, well, it says toenails, so we're going to do one today and one at another time. Is that about right?
Yeah, practically, yeah.
Okay.
But they're both dead.
Which one is worse?
That one. Dog keeps standing on it. It was like mad.
The dog keeps standing on it?
Yeah.
All right, let's have a look at it.
It's like it's got fungus.
Well, it's probably not even an ingrown toenail anymore. I think that is just a complete fungal nail infection. Shall I take the whole thing off?
Oh, aye.
Yeah.
Definitely take the whole thing off.
OK, so I'm going to change this to a total excision rather than a wedge excision. Do you want to be sitting up or do you want to be lying flat?
I want to go to sleep.
It just depends on whether you want to be able to see anything or not.
No, go on. Attack.
Attack. You're going to look up at the ceiling?
Yeah. That's a big needle.
This is just to draw up, don't worry. You get a smaller needle. Oh. I'm feeling kind today.
You got a day off today?
I booked it off just for this.
Did you?
Yeah.
You're going to feel a sharp scratch now. Here we go.
You okay? Ouch.
Okay, and then we're going to do the same on the other side. This is the worst bit now. Here we go. Sorry.
Ah!
Right, let's see how it's getting on. I'm just going to test it. Tell me what this feels like.
Feel that?
I can feel that.
Yeah, we'll give it a bit more time. So how did you meet, the two of you?
We knew each other when we were 10.
Really?
Yeah.
So when did you get together? How old were you when you got together?
4.5 years ago.
Really? So what happened in between?
I've been married twice since before I met Julia.
And obviously I got married and had a family, and then found each other on Facebook, wasn't it? He proposed to me when he was, what, 13?
Really? There's nothing like a childhood sweetheart. You never really get past that. Right, we'll get started. If there's any problems, let us know. Just shout, or you can punch Lynn. That's fine. Either or, whatever you prefer. So I'm just going to see how far your nail comes off on its own, first of all. Yeah, you're right. It's fairly loose, isn't it?
Yeah.
Okay.
Yeah, make it quick. Ow.
You're right.
Yeah.
Did you feel that?
I did.
Yeah. How does that feel?
Mm-hmm.
Okay. So what we have to do with fungal nail infections, because the nails get really thick, is just separate it out from the skin, because it does attach to the skin quite tightly.
Much blood coming out of there then?
A little bit of blood. That's normal. We are taking a nail off, so a little bit of blood is okay.
Carry on.
Thanks. Here we go. It's about to come off. There we go. A little souvenir for you and your induction. No? Right, Whitney, if you just put a bit of pressure on that for a minute, and then you can start dressing it. Thank you very much.
So do you get a lot of these then? Toenails coming off, do you?
I think I'm doing a couple this morning, and we normally get 2 or 3 a week. Right, I'll leave you with these lovely ladies.
Right,
nice to meet you.
Yep.
Take care.
I know there's something going on with your skin, so tell
It's
me a
a
little
fungal
bit about
infection,
it.
they said.
Was that what they say?
And it's itching like hell. And I can't get no sleep for it, and it's doing me head in. And I can't leave it alone.
Right. Where was it before? Was it just on your legs?
No, just my leg. And my back.
Okay.
You know the rolls of your fat on your skin?
Okay, okay.
It was under them where you get sweaty, that was all.
And how about on your hands?
That's only just started
It's only
since
just
yesterday.
started. Has it? Okay.
Yeah.
And when's that been most itchy?
Well, I find it's when I'm in bed asleep. I don't know, it's going... Do you want to look up my arms?
Please.
Oh, pleasure.
Okay.
It's not nothing like what my grandson had months ago.
What was that?
That way you pick it up from somebody else's bed.
Scabies.
Yeah, he had scabies.
That's what I'm wondering about with this, actually.
That's what I wonder. It's something that's just annoying me all the time.
I can see that, yeah.
Come on, Jay. Right, get off the pram.
Come in.
Get in. Go on. Sit down. Go sit down.
Hello.
Hi, guys. Let me put pram here.
Yeah, absolutely. Okay, right then. Okay, so I saw you, was it a couple of weeks ago?
Yeah.
And you told me that you'd been feeling quite tired
and you'd had some blood tests and they were pretty much okay, weren't they?
Yeah.
And then you admitted that you felt quite up and down with your mood, and you'd had a heck of a lot go on, hadn't you, in the last few years. The main thing we did really was give you an antidepressant, and then we said we'd see you and see how you're doing. So where are we at now?
I feel a lot better.
Do you?
There's days where it's like I get up and do stuff and like I'm not like, oh God, like that. And then there's days where it's like, but it's more up now.
Okay.
I'm not getting as much like irritable and like, it's quite hard to explain. It's not as bad, but it's not brilliant.
Yeah, okay. You're really only probably starting to notice an improvement over the last few days. And it will continue to improve. So I think we're definitely on the right track.
Yeah.
And no significant side effects with the medication that you've noticed?
Still the sleeping.
Yeah, I was going to ask about your sleep.
It's like before I slept like quite a lot. And since taking them, it's like I'm really tired, but I can't sleep.
Can you?
It's just this one don't like to go to sleep.
Right, okay.
He'll sleep for a few hours.
Look at you, shaking
then he'll
your head.
wake up and he'll think it's playtime at like 3 o'clock in the morning. Like, oh, it's like no outfit, it's bedtime.
Yeah, okay. The difficulty is because you're on your own with the children, you can't have anything that's going to make you really tired at night, because you've got to be able to be rousable and alert. So perhaps look at we call it sleep hygiene, so look at your pattern on an evening of how you prepare for bed, and most people can improve their sleep hygiene. So do you smoke? You don't smoke. So it's about no alcohol or smoking after yeah. What about caffeine?
I don't drink it.
Right.
I just stick to like iron brew, Coke, or what is it other one? Pepsi.
Normal volumes, less, more.
Right.
I don't know, I just got in late and I always find it hard to relax when I've got in late.
Oh,
I don't see that bad.
Oh, did you? How did that go? Very well.
No, we didn't go out, we just chilled it in.
Oh,
it's so cute.
Mine is currently in Newcastle.
It's proper tall, isn't it?
Oh, he's 6'5", it's horrible. It is horrible. I try stroking his head, but I've got to like proper... I love tall men though.
Yeah.
Oh yeah, because I'll never ever be taller than him. Even in my highest heels, I'm still smaller than him.
Yeah.
It's amazing.
So it's just to think about not having caffeine after, say, 6 o'clock on an evening. I know it's difficult, but sometimes things like warm baths and warm milky drinks and lavender, and there's a few kind of natural remedies that can help. I've got a really good leaflet that you can have a read of, and you might just find that just helps. Often when we are down and anxious and worried and low, it does affect your sleep. You do seem much brighter today than you did 3 weeks ago.
It's the kids helping as well.
Yeah.
They're really, well, my eldest is really good.
Are you the eldest? Or are you the eldest? They're so alike, aren't they?
Yeah. 11 months apart.
Leaflet.
Thank you.
Shall we perhaps just have another chat in about a month and make sure that everything's okay?
Yeah.
And if it is, we'll put them on repeat prescription for a few months for you.
That's brilliant. Thank you. Come on then, sit down.
Right then, kiddos. Let me grab the door for you.
Yeah.
All right, okay.
Thank you.
Take care.
You
Bye
too.
now. Bye,
See ya.
kids.
Come on, you two. Are you saying bye-bye? Bye-bye, hey. No.
Scabies is typically really itchy at night or when you're warm, so that sort of fits with what you said is happening with you now.
When I was a kid, it was really bad because she got it.
Yeah.
It makes me feel ashamed because I always keep my pets clean and, you know.
Don't feel ashamed. If I told you I've had scabies in the past, would that make you feel any better?
It probably would, yeah.
I'm not ashamed to admit it.
Can scabies cause this swelling on my face?
No, what scabies can cause is an allergic reaction to the scabies mite. And that's why you end up itching all over, even if you've only got 1 or 2 mites on your skin.
Yeah, so it's all to do with one thing?
Probably. So the cream that I'm going to give you will kill the mites when you the night that you put it on. So if you put it on today, it'll kill the mites. The only problem is that the mites being under the skin, they carry on causing an allergic reaction even though the cream kills them.
Yeah.
And for the next 3 to 4, maybe even 5 weeks, you'll be a bit itchy. So we do need to carry on with those tablets.
Yeah, I will do, yeah.
But you should notice that the itch is reducing week on week until your skin has renewed itself naturally. Are there 2 other people in your household?
Yeah.
Yeah, I'm going to do the same treatment for everybody because everyone needs to be treated at the same time.
That's all right.
Now, there's one more thing. You'll need to gather together your towels, your bedding, your sheets.
I do. Look, don't worry, our bedding and everything's gone in the hot wash. I call it a boil.
OK, all right, we're singing off the same hymn sheet there.
I'm sorry to ask you, but can you give me a pull-up?
Let's help you stand up. Push yourself up with your legs. There you go. That's it. That's
Thank you ever so much.
All right, then.
I'll take my lurgy with me, right?
You know where you're going. Bye-bye.
Okay, love. Bye-bye.
Bye.
Ciao, eh? Bye-bye. Say ciao.
Ciao. Ciao, ciao.
Say ciao.
All right. See ya. Bye.
Come on, sweethearts.
Bye, have a good day. Yeah. Thank you. Thank you. Bye-bye.
See you tomorrow. See ya.
Oh my God, Karen, guess what I had in my bathroom again today? Another giant spider.
Mia, they're not going to hurt you because it's cold out.
I like spiders from afar. It's like I like tigers, but I wouldn't want a tiger in my bathroom.
Ooh. Hi, I'm Linda Eves. How can I help?
I've just started last couple of weeks with having quite severe dizzy spells. If I'm rotating my head, I get quite dizzy.
Okay.
Yeah, it's just causing me some issues.
Yeah. It sounds a lot like benign positional paroxysmal vertigo. Have you heard of that, BPPV?
No.
OK.
No,
It's
it's a good
big
one.
thing,
Yeah,
isn't
well
it?
done. Yeah.
Classically, it's sort of rotational movements of the head. It can be looking up or down or turning your head to one side. And it tends to then set off this sensation of spinning or turning or unease. Is your general health good at the moment?
I've just done the Yorkshire Marathon, so
Well,
I got
that's a
around
yes.
there OK, so I think I'm OK.
You're OK.
Yeah.
Let's check your blood pressure. It's fine, no problems with that. 122/80.
Yeah.
Let's tilt that slightly that way. Great. OK, well, there's nothing in the ear canal that's causing any increased symptoms and there's no signs of infection or anything. So if you're happy for me to go ahead, I can do what's called the Epley manoeuvre. So in the semicircular canals in your inner ear that are responsible for how you orientate and so on, they can get some little tiny crystals that form in there, which when they move over some little hairs with fluid, they create a sense of imbalance.
Okay.
And so the repositioning techniques help that.
OK.
Right. Ready?
Yeah, ready.
OK, down you go. OK, keep going, head over the edge, right down to the back. How do you feel?
Yeah, it's just wobbling a little bit.
Sit yourself back up. Have you noticed at home or whatever, if there's one... OK, that's worse, isn't
That
it?
did it, yeah.
That did it.
Morning, Katie. I'm Debbie. I'm a nurse practitioner. Who's this lovely lady?
Mummy.
Your mum. All right. And I've got Andrew here who's learning to be a doctor and he's just watching us today. Is that OK? Right. What can I do for you?
Since, probably Friday time, she's had this rash on her cheeks. All up her arms, all on the legs.
She's not been poorly?
No.
Not poorly?
But she was real hot this morning.
Right.
She's had some paracetamol and she seems OK.
Right, so this is the thermometer and I'm just going to check your temperature now. Is this rat itchy?
She had been scratching it a little bit on her face, but Not that itchy, is it?
No, it's a funny little rash, that rash on your face, isn't it? It's a little bit blotchy.
Yeah.
Have you got a sore throat or anything? No. Can you do a big wide mouth for me? Say ah, stick your tongue out. Say ah. No cough, nothing at all. No. Can I have a look at your belly?
That seemed all right. It was just like her arms and legs. It's gone a bit down on her arms now.
You can see there, can't you? Was it, when it were bad, were it raised?
No.
No, just like this. Every rash we get, I mean, I can tell to look at, she's not poorly, but we do the, you know, where you talk about the glass test, we just pull it like that and you can see that this rash goes completely. Well, you're a mystery, aren't you?
You are.
That's part of your charm, isn't it? There's a little bit on this on her face that looks like a thing called urticaria, which is just a rash that people get, and often they're a response to a virus. We don't treat it, we just say, see how you go, and you can take some antihistamine if you need it. She's well, and that's the main thing. It's coming and going, because it's gone, you know, from her arm, so I think it will settle. It might take a couple of weeks, all in all, but bring her back if it gets worse. Bring her back if she's got any other new symptoms.
Back to school tomorrow, then.
Back to school tomorrow. But today, you've got our permission to lay on the sofa, get telly on, get your feet up, and let your mum run after you a little bit. Is that all right? I love your glasses. You look so brainy in them. Are you brainy?
You are.
You are, I can tell.
Clever clogs.
Okie doke. All right, then.
Lovely, thank you.
All the best. OK, don't any worries, you know, just bring her back if it gets worse. See you later then, chick.
Hi.
Have you ever had your hair cut?
She had it cut quite short, about up there.
Long.
And then she decided she wanted to grow it again,
Oh, it's beautiful, isn't it?
Yeah.
Let's have a look. I'll be touching your bottom next time we see you.
Oh, that's what she's hoping for.
See you later, love.
See you later.
See ya.
Are you ready? Okay. So lie yourself back. Okay. Right over here. How do you feel?
Yeah, that's doing it.
That's doing it. Okay. Turn over this way. Tell me if it sets it off.
Yeah.
Yeah. Oh.
yeah, right. And it's normal again now.
Okay. Keep turning your head a bit further over. That's good. Stay in that position. Turn your head a bit further forward. That's perfect. Are we okay like that?
Yeah, I'm good, yeah.
You're good. Bring your knees forward, so you're going to end up sitting forward facing my desk. Okay, how are you doing?
Yeah, I'm pivoting side to side rather than going...
Okay.
Rather than it being dizzy. That's it, it's settled down now.
Settle down.
Yeah.
That's quite quick. We'll get you back over in the chair.
Yeah.
You all right?
Yeah, good.
Okay, up you get then. Okay, keep looking there. Round over here. And sit down. Okay. You can't drive when you've got symptoms of vertigo, so looking over your head and so on. Hopefully, with this repositioning now, things will be quite a bit better.
I think I'm at that age where I'm collecting things now. So it's, yeah, the eyesight went last year, the ears went 2 years before, so it's just waiting for the next thing.
How you doing?
Hi.
Not bad.
Like your waistcoat.
Pulls my tummy in.
Oh yeah, can I have one?
I use it as a corset, if I'm honest. When I get home, I go...
That's very nice.
They contacted me upstairs because they said you were really poorly and needed to be seen urgently.
I've been in hospital for 9 days. I just come home yesterday. But what it is, I can't keep knocked down and I'm in agony.
OK, let's go back a bit. So tell me about what happened.
Basically, when I went in hospital, I got up that morning in bad agony like I usually get. And then I started vomiting up like brown stuff and blood, pure like red currant blood. I hadn't been at the toilet for like 10 days.
OK.
And he thinks that I've had functional dyspepsia with my stomach, but they want do some tests to check the nerve endings. Because also they were worried it might be gastroparalysis.
Yeah.
But I've just been in really bad pain and I can't keep knocked down.
Don't worry, we'll be able to help with all that today. I just want to make sure that you understand what all those terms mean.
I know they explained a little bit that if it is gastroparalysis, it's basically where your stomach becomes paralysed because of the nerve endings.
Yeah. You are right with gastroparesis, where it means that the stomach isn't moving things out of it down into the gut very well, and that can lead to food being there for a while, which in turn leads to more acid to try and digest that food. And dyspepsia is just a posh word really for acid production, over-acid production that can come up your food pipe and cause all sorts of pain and problems there. Do you mind if I have a feel of your tummy today?
Yeah.
Is that OK? You're able to come up on the couch. Who's looking after the children while you're in hospital?
My partner.
OK. How are the kids?
All right, you just missed me.
Oh, I bet. Right, I'm just going to lift all this up. So just bear with me, my hands are a bit cold.
Okay.
When was the last time you had anything to eat or drink?
Yesterday.
And you said you haven't opened your bowels for how long now?
10 days.
10 days. Do you feel like you need to go and open your bowels?
I just feel like there's a lot of pressure there, like I do need to go, but I just can't go.
When they did the camera test up your back passage, did they tell you that you might be constipated or anything?
You could see there were a lot of poo there.
Was there? Okay.
Yeah.
Okay. Come off there and we'll have a think about things.
Well, it's basically, I come today to see if we can get a bit of anti-sickness off you because I can't keep knocked
I
down.
think that's fair enough.
And I'm losing a lot of weight. It's like when I was in there, I lost £2 from the Saturday to the Saturday, and then in past 6-7 weeks, I've lost over 1.5 stone as well on top of that.
Okay.
So they're really worried it's going like to a dangerous weight.
Severely underweight.
I feel weak.
Yeah. What we'll do today, get you on some anti-sickness medication. I know you're on the pantoprazole already, I want you to stay on that, but I'm going to give you something else to help form a coating over the lining of your stomach. I'm just a bit worried that if you don't open your bowels in the next 2 or 3 days, we might need to think about giving you an enema to try and move
I've had
it.
enemas up there, and neither of them worked.
Well, what I'll do, just to try and get things moving a little bit, is give you some little suppositories that you can use yourself morning and evening time. Does that sound all right if we do those 3 things? Anti-sickness, something for a coating on your tummy, and then something to help.
Yeah, they're the little bullet phones out there.
They are, yeah. They're not very pleasant, but they'll help.
It'll help, yeah. Oh, it's better than having what I've got right now.
Yeah, I know. You look like you're struggling there.
I am. I'm in pain, and I've got no energy or nothing.
Oh. Well, why don't I arrange to see you in about 2 weeks' time?
Yeah.
And we can weigh you, see how your pain is, and make sure your weight isn't dropping any further.
Yeah,
I'll send you
brilliant.
that appointment out so you don't need to worry about that.
Yeah,
All
thank
right.
you.
OK,
Doctor.
my pleasure. Now, I believe you've got something on your finger to show us.
I have.
Does anybody put a finger on how to feel of your prostate?
And like there, it's like the skin peels off. It's like it's burning.
I just can't put my finger on why his blood sugars have gone up.
Oh, come on, Hannah. Stop it.
He's going for it,
He
isn't
just wants to bite.
Can you just follow my finger with your eyes?
Well, work sent me on because, you know, it's too dangerous. I already lost a finger, you know, in the machine.
So he chopped his finger in the car bonnet.
All right, I'll speak to you then. Fingers crossed.
I was just reading about your finger. How are you?
I'm all right within myself.
So, is it painful?
No, not really, no. It's not painful. Only if, like, I accidentally hit it off or something, then it really hurts, but...
And can you bend your finger okay? Yeah. Yes?
Yeah.
So, is it just the top?
Yeah, it's just the top end. They've given
Did
me...
you have surgery?
No. I didn't go ahead with it because they said to me I could either have the surgery or not, just let it heal. So I just said there's no point doing it.
Sure.
They've given me this dressing.
Now, are both those dressings on now?
Yeah.
My goodness, you must have gotten a shock.
Yeah, but do you know, I was so calm. Everybody was really shocked with me,
You were the calm one?
I was really calm, yeah. Everybody else was, like, flapping everything. But I was really calm.
So what kind of surgery would they have done?
Basically, they would have cut it down, cut my bone down, cut it all away and shaped it off. Because basically what's going to happen now is once it's healed, it's not going to be healed rounded, it's going to be healed flat.
Right.
So it'll still have the length, but it won't have the shape.
OK.
Whereas if I'd have had the operation, it wouldn't have the length, but it'd have the shape.
OK. So you stuck your finger in a coffee grinder, is that correct? Yeah. Oh, you took it off? Oh, well done. Now, how does that look to you? Because I haven't seen that before.
Oh, it looks really nasty. Well, the scabs come off. It's not very nice.
My goodness.
Disgusting, isn't it?
No, it's healing. It's healing. Did they say that it would eventually just take time?
Take time, but it will heal eventually, and my nails should grow back as well.
Were you in a lot of pain?
No, it wasn't painful. It was more like a throb.
Oh, a throb.
Here and there, it felt like a little needle just poking it.
OK, so this goes this way.
Yeah.
Up.
Yeah, it goes like that, yeah.
Are you right-handed or left-handed?
Right-handed, yeah.
So do you find it really
difficult with it? Yeah, but it's not too bad, really. My scabs come off, and I'm happy about that.
I'll give you an extra bit of this just in case.
Yeah. It's lovely.
My goodness. There you go.
Lovely. Thank you very much.
Pauline Donnelly.
Yeah, love.
Hello. Like to come and take a seat?
Yeah, love. Oh, I need... It's down this side.
Say that again, sorry?
Me thingy is down this side.
All
so
right.
do you wanna...
Yeah, so let me... Tell me that... So is it a rash that you've got, sorry? So...
I was bad under me red and sore.
Red. OK, yeah.
Under me and in my groin.
Yep, down below, yep.
Yeah, down below. But this side were more bad. It was like blistering and like a little abscess.
OK.
And it was bad. This is all cleared.
Yeah, all good.
Apart from...
Down there, yeah.
So when I was getting a nice shower yesterday, last night, it was gunging
Not
and...
very nice. OK, yeah.
Not nice.
OK,
Get smell.
OK, yep.
Yeah, so... I could have seen a male doctor, but
Yeah.
I'm not being... I'm 62 years old and I feel a bit embarrassed.
Yeah,
you know
no,
what I
that's
mean?
fine,
I know
yeah.
it's their job and they don't.
Yeah,
But
no.
I
Yeah, no, we understand. We
Yeah, I
understand
do.
that. And how are you feeling yourself? Feeling hot, feverish?
My face, all here sweats.
Right.
Right, all the way down, all on it. And the only time it don't sweat is when I'm not so well. And look, I'm not so well.
And
it's
you're not sweating?
No.
Should we check your temperature then,
If you
just to
don't
make sure
mind,
it's all
yeah,
right? So we're
yeah.
doing this here.
Right.
Yeah, that's perfect. It's good. So should we have a little look down there? Do you want anyone else in with us? So one of the
You're all
nurses,
right.
are you happy for me
If
just
you,
to have a look?
If you want to bring somebody in...
No, I don't mind. It's really up to you.
don't
Whatever's
mind. It's up
comfortable
to you.
for you.
If you want to bring some...
Yeah,
you know,
no,
to do.
that's
Right
fine.
then.
Do you want to pop yourself on there?
Yeah.
Sorry, the bed's a bit of a...
It's all right, darling.
hard
It do-
angle. So
Oh.
what I need to do is just, are you able to pop everything down for me and just let me know when you're ready and we'll have a little look?
Yeah, I'm right. I'm ready, lovey.
OK, I'm just going to pop some gloves on.
Right, lovey. It's in... Oh, God. Oh.
You all right there?
No, I'll have to sit up a bit more.
Do you want some help? Are you OK?
Could you just lower... higher this up a bit? That'll be all right, yeah. Yeah.
Right.
There. Can you see it? Yeah. It's there.
And did you say there was some gunk
Yeah,
coming
it's
out
a
there?
bit... Yeah. There. That, and she's all there, and you can... Here. I'm not being awful. And here...
Can I have a good feel? Is that
Yes.
all right? I just want to make sure there's no lump or anything there. I'm very sorry if it hurts.
There was a lump there and I explained it. But further down, he had like down that bit, yeah, where that bit down there, it was a lump.
All right, you can get yourself dressed.
All right,
Should I help you up with this?
Oh, yeah, if you don't mind. Right, I won't be a minute. Oh, thank you.
All right.
Got to get up. Oh, God.
You okay there?
Yeah.
Yep.
Won't be a minute. Because by the time I come, they'll be sick of me.
OK, so looking at that kind of area, I mean, it looks like the spot that was, seen a couple of weeks ago, it looks like it's popped. So that's what all that gunk was that must have come out. It actually looks really nice and clean.
Good.
So you've still got kind of a bit of that fungal rash still a little bit there, but the infection, or what I think the doctor before thought that it might be a bit infected, so gave some antibiotics. It looks like that's done the job. So we'll have some more of the cream here. Is that all right?
Yeah, that's lovely.
OK.
Oh, God.
You OK?
Yeah.
All right, then.
Thank you.
Sorry, I've got very cold hands.
Yeah, oh, no, lovely night.
All right.
Yeah,
Bye-bye.
I'm glad to hear it.
Yeah, I was telling them about my holidays. I said, I've just been to Corfu. I said, do you remember what happened in Corfu? She went, yes, I do.
Is it a case of what happened in Corfu stays in Corfu? I don't know why we always say that. You must have had a good time.
I bloody did, yeah.
Do you know something, Veronica? You're never miserable, are you?
I'm not believing it.
Good on you, Veronica. Good on you.
Hello. Is it 7 here?
Mrs. Di Francesco.
Yes, I am.
Hello. I thought I'd lost you.
I lost myself. Yeah. Non mi rispondo, I lost myself.
Come in, take a seat. How can I help today?
Well, sometimes I have a terrible headache.
Okay.
And I get a pain from me. It go... I know I worry too much for my husband, Paul. Anyway, very Paul.
So you're always worried about him.
I have too much trouble in my house. Too much.
Why?
Because he said, you lost Rita. You're going to lose it, you lost it. Because I've done it twice. I work, I reach in Bradford. I say, oh my God, what happened now?
Oh, so you lost your memory?
Yeah, because I'm suffering so much from my husband.
Does the headache come on every day?
I have every day, just sometimes from dun.
Yeah.
I say, oh my, what's happening? And he gone.
Okay. When was the last time you...
Because I suffer so much in me, that's all, because I love my husband.
I understand that.
And I see maybe day by day, can die.
Yeah, no, I understand that. But the thing is, let's talk about you today, okay? Because you spend so long looking after your husband that we also need to look after you, okay?
Oh, lovely.
But let's just go through your memory. I'm going to ask you a few questions, which might sound a bit silly, but it's just to test your memory and see how it is.
Lovely, test me everything.
Right. Okay, we'll test. So what's the day today, do you know?
Just a minute, I don't remember now.
It's okay.
And my husband told me as well and forgot. That's it, that's my...
So you're forgetting me like that. Okay, don't worry. Let's go with something a little bit
Maybe my head go crackers.
No. Well, I'll tell you when it goes crackers, okay? So don't worry. So can you count forwards from number 1? So number 1...
From the U, yes.
So 1?
Number 1, 1, 2, 3, 4, and 5.
Good. So can you count backwards now?
5, 4.
Yeah, then before that?
3, 1.
Okay.
1, 2, and 3.
I can see that obviously the memory is sometimes a bit weaker, isn't it? And that's why you forget sometimes where you're going and if you put things down.
I'm very, very...
How long has that happened?
Sometimes I go downstairs to cook.
Yeah.
I forget. All my pan come... I smell, you know, because it burn. It's happened too much, this.
How long has this happened?
It's more than 2 years.
I think we need to get it tested and checked. What do you think?
If you help me, I will go in paradise.
Who do you have to help at home?
I go to the nursery with my husband.
So let me just ask you a question then. Do you ever forget to lock the door?
Too much. Me forget all about.
Okay, because I think you might need some more help at home. So help with, like, maybe making the locks more secure, helping with the cooking and things like that. Well, what I'll do is I'll arrange the blood test, but I'll come out with you and we'll arrange the appointment together and we'll make sure that you get a card so that you don't forget it.
Oh, lovely.
So let's go outside and we'll book the appointment for your blood test.
Oh, my God, I wish you
You're lovely, don't worry.
You're lovely.
It's going to be fine.
You're lovely. I see a lovely lady today, my God. Nice and gentle, it doesn't make people look better.
Don't worry, we're just going this way. Come on.
Yes, all right.
Right, how are you doing?
Not that good.
Really?
But I'm doing good myself.
Okay.
I got back on my anxiety medication recently.
All right.
I just wasn't doing too well, but back on it now, feeling 100 times better.
Good.
My skin has got worse.
Has it really?
Like under my boobs is really bad, and my legs are quite horrific again.
Oh gosh, because we tweaked your lotions and things, didn't we, last time?
It just made it really painful. Like my skin cracked a lot.
All right, I'm sorry that didn't work for you.
Oh, it's just a bit of miss, isn't it?
Well, unfortunately, that's often the way of it. So what works then? So the moisturisers you're putting on regularly.
And sunbeds.
And there's some okay. Us in the dermatology fraternity aren't big fans of sunbeds because, but I can see why people like them because it can help. Right, would it be all right to have a look at some of these areas now then? Let's have a look.
These are like the worst.
Oh, yeah.
So that's quite, they look like bruises now, which is quite scary.
Yeah, so there's a lot, I can see that that's difficult to put lots of the creams on without getting it on the healthy skin and things. It's a little bit dry, isn't it, in some places? Yeah. Okay. Like all skin conditions, it's all very subjective.
You can never find a cure, unfortunately.
Yeah, unfortunately for psoriasis there isn't. And it's very much how much the skin's bothering you to know how far we go with different treatments. Because most treatments and things, like you found with that lotion, unfortunately, can irritate, can make things a bit worse before they get better. So it's very much up to you. What are your thoughts?
I would like to try maybe something else if there's something you can recommend.
Okay, yeah. Steroid for the redness we could try. We have to be slightly careful about how strong we go, but we can give you a steroid cream and then put some moisturising cream on all over, because I think that will help.
Will it ruin my tattoos?
Shouldn't do.
I paid a lot of money for these.
It shouldn't do, it shouldn't do. Well, why don't we just go for one thing at a time, maybe? Why don't we go for this, Umivate? You're going to increase your moisturisers, and then we'll see you back, and we'll see how things fare, OK? And I've just put this on once a day, and I think you mentioned when you first came in that your mood is better, your weight's coming down. Both of those have have
And
a
I'm quit
positive
smoking.
effect on the...
I've done it, yeah, I'm on vapes now.
Oh, fantastic. So there's three
Yeah.
really good things that will probably improve psoriasis.
Yeah.
You know, certainly in a lot of people, if those three things are improving, then psoriasis does get better. So, well, I'll give you this slip.
Thank you.
You know who I am, don't you, Dr. Caris?
Yes. I refuse to see anyone else.
Yeah, oh, that's nice, thank you.
Well, thank you so much.
All right.
Have a lovely day.
Okay, good luck with
Thank you.
everything. See you later. Bye-bye. I mean, she's nice. She was positive, isn't she? And that's got a massive effect. If you can cope with your skin, you're going to do so much better. You know, I mean, how bubbly was she? It was lovely.
Everyone's got nicknames for me, it's amazing.
Like what?
Beth and Lorraine call me Ebbers.
Ebbers.
Assad and Ruth call me E-Bonnie. My mum calls me Ebby, Ebbs. Idiot.
Okay.
No, mum doesn't call me that. People just go, bloody idiot.
Take a seat.
Hi, William. Hi, I'm Dr. Khan. Nice to see you. Come and take a seat. Right, I'm seeing you for your left toenail. Is that right?
It's right.
Ah, OK, right.
The left one was done a couple of weeks back.
Let's have a look at it, shall we?
It's this side.
Yeah. OK, yeah, we'll do an excision of that side there. Right, hop onto the bed. So what do you do, Will?
I'm a student at the university.
How are you? What are you studying?
Chemistry.
What do you want to do with your chemistry qualification?
Well, I'd hope to go into something like the atomic weapons establishment.
Oh, wow.
Go into that sort of stopping nuclear proliferation.
Stopping it? Good idea.
Yeah.
We like that.
Wow, we've got a right.
I know.
I'm going to be like this now.
I mean, we were talking about GCSE chemistry before you came in. It's not really the same level,
My
is
mind's blown now.
Like Bunsen burners.
Yeah.
It's all right, I'm a medicine enthusiast. I tried to go into it, but did not have the A levels.
You're too clever for medicine. I mean, I'm taking off a toenail, you're going to be saving the planet. Right.
I don't like needles.
Right, don't worry.
Right, here we go, William. All right.
Okay.
Sharp scratch, sorry. Well done, mate. It's gonna sting now. I know.
God, it's so awful.
I know.
Hello, come in. Hi. I'm Dr. McFadden. This is Harrison, our medical student. Have a seat. Right, my love. So, you're here for your knee injection.
I am.
You are. Which one do you want doing today? Because we can't do them both at the same time. The left one's worse than the right, yeah?
Yeah.
Just out of interest, are you right or left-handed?
Right.
Harrison and I have been talking this morning. We've been trying to work out if you're right-handed, does that mean you're left-footed? Do you know? I don't know.
I don't think it does.
Does that mean that when I go for a walk with a dog, which one I start off with?
Yeah.
First? Yeah, I usually start with.
Do you? So you're left-footed,
yeah.
and that's why your left knee's worse. Pretend you've got a ball in front of you.
Yeah.
Which foot would you use to kick the ball?
But if you were Harry Kane, I'd probably be all right, yeah.
If you're
with
gonna
left leg, but when I'm kicking a ball for him and getting a goal, you know, going, hey, Bowser, you know, Bowser, whoa, catch this ball. I can send him halfway down Wibsey Park with the right leg than I can with the left.
Brilliant.
Yeah.
In your own time, can I ask you to come and sit up here, please, my love? So this is a great knee to look at.
Yeah.
Is there a point in your knee where you struggle with it the most? Is it, or is the pain everywhere?
It's just there.
Around
That's
there.
it, round there, nowhere else there.
On this, yeah?
Well, I had cancer last year, and I had a breast cancer tumour removed.
You did
last
not?
year.
Gosh.
I did, yeah.
Right, so you're looking after yourself now.
Taken out in this year as well.
Okay. Right, so you understand the importance at the present time of looking after yourself. That's
yeah.
Brilliant. Tell me about your dog.
My dog is 95% idiot, 5% staffy.
Ah, girl or boy?
A boy.
Nah. Brilliant. There we go. We'll have no blood, but just remember and wipe your X marks the spot off later, or people will be digging in there for parrot treasure.
Oh, yeah, I'm sure. Bit of uncharted, eh?
Absolutely.
Right, that's 1 out of 2. Here we go, 2 for 2, and then we're done.
God, I think I'd prefer if you just did it without
Oh, no, I
antiseptic.
don't think you would. You okay?
Yep.
Is it going a bit numb now?
You done?
Yeah. Right, that's the worst bit over. Now you can sit back and think about carbon, lithium, what other do we know? Plutonium, is that real?
Yeah.
Isn't that just from Superman?
Kryptonite.
Kryptonite.
Krypton's real.
Right, close your eyes, Will, and tell me what if you feel pain.
Feel it, it's not painful.
Well, I think we should start because a bit of pressure is fine to feel, but if it gets sore or painful, let us know and we'll put a bit more medicine.
I'll tap out.
Right, here we go.
I can hear that clipping.
Don't think about it. Think about nice things.
Have you specialised?
I do a few different things. I do this, I do diabetes mainly, lots of teaching.
Have you got a title yet?
I am an honorary professor. Right, you're all done. Not too bad, eh?
Put your lovely bandage on now.
Right, Will, I'm going to leave you with Karen. Pleasure doing business with you and good luck.
Thank you.
I expect the world to be a safer place after you qualify.
Yeah.
They do scream, you know, the frogs.
Becky, don't I feel sick?
They do. Honestly, our cat once caught one, and I went out and you think, oh my God, what's that screaming? And it caught a frog.
I thought they just rib it.
No, it proper screamed.
And what was the cat doing to it?
Well, it got it in its mouth, but it was a bit rubbery for it, you see, so it let it go eventually.
Oh my God.
Well, we're having a disaster today. I don't know how much the receptionist will have told you, but the computers, they haven't been working at all. And that I can't log on at all.
Just them that hurt me so much, and when they go wrong.
Oh, I'm maligning them today, I tell you.
Yes,
thank you. Come and have a seat.
thank you very much.
I'm Dr. Moncrief.
All right, okay.
So, I'm going to try and open it up.
Right, okay. This could take some time.
But it's already got its little egg timer, which means nothing's happening. So I think the best thing to do is for us both to acknowledge I can't see anything useful on here. Okay. So please, can you tell me what brings you along?
Yeah, I'd been to the doctors and I just happened to mention that I got a couple of areas of skin that were a bit odd, really.
A bit odd?
Well, they sort of were sore and never quite healed. And it just, this has been going on for a couple of years, sort of thing.
A couple of years?
Yeah, it's on my face then. I've got one on my leg.
Right.
And they sort of come and go, but they never 100% heal. And this one on my face had been bleeding, it scabbed over.
In the past, have you had any other trouble with your skin at all?
No.
And would you say you've had much in the way of exposure to the sun?
Probably in my youth, I'd probably sunbathed quite a lot, yeah.
So where is it on your face?
So it was, you can hardly see it on there now.
Thank you very much. So for this one here, it's certainly it's not anything dangerous at all.
Right.
It's likely to be a bit of very early sun damage.
Right.
Yes?
Yeah.
And people worry about that because a small proportion of them can eventually go on to be a type of skin cancer.
Yeah.
How can I help?
Yeah, so Eva is not feeling well. From yesterday, she had all night temperature. She was vomiting. How many times you vomiting yesterday?
3.
And what else?
Cough.
Did you have a cough?
Throat pain.
Oh, so you've got a sore throat as well?
Yeah.
I'll have a little look at that.
I feel cold.
Do you feel cold? That might be because you're a bit warm. Funny that, isn't it? Let's check your temperature. Great. There we go.
This is sweet.
Good girl. Slightly raised again, isn't it?
It helps. Why is it taking long?
Good girl. Okay. Now then, let's have a look in your throat. You're going to go, ah. Oh, goodness, look at that. Just relax your tongue a bit.
It's doing that.
Wow, what a tonsil. Come and see this tonsil. I bet it's sore. Open your mouth. See how big that tonsil is?
The right one.
So it's one really big tonsil. It's also got some white stuff on it, hasn't it?
Is this normal?
It's quite big, isn't it?
Yeah. It's very big.
And it's, you're ticklish, aren't you? Try to relax.
She's snoring.
Yes, I should think she does. Is she snort every night or just
Every
now
night.
that she's unwell?
Every night.
Just put your chin up for me. There we go. All right, that's all right. Okay.
Chill out.
How did you know where my tickle spot is?
Let me just listen to your chest at the back, my love. Just nice big breaths in and out through your mouth.
What?
Copy me, copy me.
That's why I can't believe her sometimes when she's seriously sick or not.
Yeah, I
Because
know.
she's so naughty.
Give it on again.
Okay, my love, that's fine. Now I need to check your tummy over, don't I? So would you stand up and come over here for me? Good girl. Lie yourself down. Excellent. I knew you were ticklish. Why did I even think this was going to be easy, eh? All right. Off you get. There's a good girl. Now, I'm going to ask you a few more questions about this snoring and see if it's something that perhaps might need to be referred for. They do sleep studies. So tell me exactly what you notice when she's asleep. Does she ever stop breathing for a few seconds and then sort of like that? And how long a time is it that she's doing that?
It's like going like this all night, no stop.
Does she always sleep on her back or
She's sleeping every side.
Which way? All right then. Right, let's do that referral now. And here's the penicillin. It's 1 spoonful 4 times a day for her tonsillitis, okay? All right, thank you for coming in. Nice to meet you. Bye.
Bye.
Now, the one on your leg? Yes, that one's much more characteristic. So that one's a bit, as you can see yourself, it's a bit thicker. It's progressed a bit further.
Yeah, yeah.
So none of these is dangerous. The one on your face has got so much better that I think we might well be able to help it on its way just with some gel.
Okay, great, yeah.
This one, the way to be 100% sure would be to have a little sample taken of it, a biopsy, to be looked at under the microscope.
Sure.
This is not an emergency thing because
no.
these are not dangerous cancers, right?
So is it that basal cell?
Yes.
Is that what it is?
The old-fashioned name rodent ulcer. Modern name basal cell carcinoma, which is rather an alarming name.
It is rather, yes.
But it shouldn't be really, because it's not the sort of thing that would spread anywhere else in the body and make you ill. It's not like malignant melanoma. It's not like that at all, at all.
No.
I'm going to have a go at entering this on here, but I suspect you may have to join all your people who've been here earlier, and I've got to write it down. And when it's working properly, I'll have to put the details on the computer and do the letter.
It's a good job we've got a pen and paper still, isn't it?
Well, we can still talk to each other, whether the computer's here or not.
Now then, you. Are you going to smile for your Auntie Debbie today? Are we smiling today?
And as long as I'm mobile and I can keep smiling, I have a chance.
Well, we all got to think like that, haven't we? All right.
Hello. You're a smiler, aren't you?
From my point of view, you're doing pretty well.
Yeah, that'll do. Yeah. Look, smiling. It's nice. It's lovely to see you, innit?
Yeah.
There we are.
Come in. I'm Dr. Khan. Come and take a seat. How are we doing?
Oh, not bad. I can't complain.
Oh, that's good. Come and sit down. How are things with the diabetes?
Well,
oh, perfect, yeah.
as you can see, my mornings.
This is the most organised book I've seen in a long time.
It's about all he is organised then.
All right.
It is.
These readings are really good. Now, the blood test here, as you know, shows us your average reading over the last 3 months, and yours is excellent. It's better than it was before as well. Your average reading is 7.5, so bang on where we want it to be, really.
What about my waterworks? Is that all right?
What do you understand about your kidney function?
Nothing.
Nothing?
All I know is I'm diabetic. I don't have a bladder. I have a pouch.
OK.
I have a stoma.
Right. That goes directly into your bladder?
It's gone.
Into me.
What happened to your bladder?
I had cancer.
Oh, did they take your whole bladder out?
Yes.
OK.
Everything.
Right, OK.
I had a massive polyp removed from my bowel.
OK. Was that bleeding?
Yes.
It took him 150 minutes to remove it.
Wow.
And I watched it all on telly.
Yeah, were you awake?
I was
yeah.
wide awake. It was massive.
Fascinating stuff.
I've also been in with meningitis because I had sciatica and I went for some injections in my spine for pains in my legs. I got out of bed about 11:30 and I collapsed on the bathroom floor and she dialed 999.
Yeah.
And I was unconscious for 3 days.
Gosh. So let me get this straight.
Believe me, I'm heart attacks, started with heart attack.
So let me just get this right. You've had bladder cancer, you've got no bladder, you've got that back now.
Right.
You've had a massive polyp removed from your bowel, thankfully just a polyp. You've had meningitis, you've had heart attacks. Let me tell you something. Your diabetes is perfect, beautiful.
But you still got it.
You've still got it.
I'm not bad for an 88-year-old.
You're not bad. Well, I don't know. Looking at that list, people might argue with you there.
No, I've got through them, haven't I?
You've got through them, and you're still smiling.
Yeah. I know what my mate now is getting me 2-3 plates.
Yeah.
Well, I want to shake your hand because you've been through so much, and you are so positive. And smiling, even without that tooth. Right, thank you so much.
Thank you very much.
Nice to see you.
Yeah.
Thank you very much. Cheers, lovely to see you both. Take care.
Bye.
Bye-bye.
Bye-bye.
Which way did we come?
Quicker that way.
Quicker this way?
Yeah, just go around there. Cheers.
Thank you.
Bye.
Can I have that back, please? Hey, what's your name? Hey, you got all shy. All right then, see you later.
You're in charge. Give that to the chemist, he'll give you some medicine.
Yeah?
See you later. Oh, I love them shoes. See you later.